Haven't seen you in a while, been very busy doing lots of things out of county and elsewhere, but perhaps we can kick off with the Ipswich Star morning exciting headline: primary pupil 4 years of age battling with obesity. Now there, obviously our healthcare program is working well. We also apparently have an increase in smokers. So the transfer of public health responsibility from the primary care trust to the county looks to be working awfully well, doesn't it? So more on that later in the year. Let's have a quick look at what's been happening in Felixstowe. Some of you may have gone, hopefully, to see Wings on Waves that took place on Sunday in wonderful, wonderful weather. It was a very popular event. The church service that preceded it in the morning was well attended, superbly conducted. The bishop made perhaps what might be his parting sermon to the community of Felixstowe, and that went down awfully well, as did the march past. A couple of things that are coming up with which I am particularly interested and involved is those of you who weren't able to get to see Susan Hawke's very illuminating play, which is both a musical, a historic play, a comedy, and a kitchen sink drama in health and in sickness. You will have the opportunity to see it at 4 venues between the 13th and 16th of September, so put that in your diary. And running with that, you will have the Felixstowe Open Days, which is returning because of popular request. And during the course of that, Felixstowe TV will be open on the Saturday, as will be Felixstowe Radio, for you to come in and take part, perhaps make a program, do whatever. On Felixstowe Open Day, we've got a lot of the old faithfuls coming back, but what we do have uniquely, hopefully, is the opening of 3 Martello Towers. That would be Tower P, Q, and R. More on that in the future. So can we now move to today's guest here in the studio? And hello. We have young Laura Dangerfield. Some of you may know Harry and Pam, who've been in the town since 1975. Nearly locals. Speaking as a non-local, married to an East Anglian, I know how that is. Now, our cameraman's just trying to centre us up there. He's getting there. There's a knob that he needs to turn, and he's cracked it. I think he has. But he's still recovering from the excitement and shock of doing his first live interview, which went out very well. I'm sure that you young folk out there are considering whether to have alcohol or drugs will have learnt the danger of doing the latter. Thank you very much, young man. That looks grand to me. I think we can commune with our viewer, hopefully. Thank you now. Now, Laura, I've known Pam, and I was trying to work out when I first met them, and I can't actually.
Really?
It feels as if I've always known them since I've been here. But that probably isn't true, because I didn't become active or a supporter of the group that they did until way into the 80s, I think. So, but I must have known of them. And your mum has been, well, she was a mainstay in certainly supporting many, many groups, whether it was the school, whether it was the International College, whether it was, I mean, Langer School, I think she was a governor there forever, wasn't she? And then she went and she did, I mean, she must have been instrumental in many more children reading well coming out of the Langer School area, probably than any other person in our town. So you kids out there who used to listen to Pam Dangerfield, listen up to the support that she could have had in the latter years of her life, because she had a serious medical condition. And there is an organisation called the British Lung Foundation.
That's correct.
Which is who we're talking about this morning, Laura. Is that right? And hopefully you're going to tell me all there is that I need to know about all of it. And perhaps if we were to go through their pamphlet, that might give us some guidance. But what we're really here to do is to talk about a fundraising event.
Yes, that's right.
That you're organising.
In honour of my mother,
Yes.
raising money for the British Lung Foundation, and we are having a charity craft fair at the Trinity Methodist Church on the 10th of August, which is Carnival Day, and we'll be next door to the art group.
So now, this was something that I didn't mention because these two are coincident in that you've got the Felixstowe Art Group in 3 rooms of the building, and you, your craft group, will actually be in the church itself.
Yes, that's right.
But you do have a kitchen there, don't you?
We
so
do,
that's a
yes.
part of your offer, isn't
Right,
it?
yes. So we're charging £2 on the door, but that includes coffee and cake. And you might...
Or tea.
Or tea or
tea?
squash.
I mean, I'm a tea drinker.
Yes, absolutely. You don't absolutely have to have coffee. You
No,
can have
I'm
cake
just...
to it.
Right. But no bacon butties.
No bacon butties,
No.
I'm afraid, but lots of really nice cakes. And we've got a couple of gluten-free cakes as well.
Excellent.
Yes. So
okay, so within Trinity Church on Saturday, and you're kicking off at 10 a.m., is that
10
right?
10 a.m., that's right, yes.
10 a.m. to ever, you said. So
Yeah,
you could still be there at midnight.
Well, we might do. We're hoping for, if people, after they've seen the carnival go past, they might want a cup of tea.
Oh, I'm sure they will.
Or to pick up some nice craft, because we've got lots of crafters there, obviously, as well.
Right. So just on that point, sort of how many, what would you call them, participants do you have? And what sort of craft is it that folks can have? Because Christmas isn't far off,
That's
is it?
true. That's
Christmas,
true.
buy early for Christmas.
Yes.
Support the British Lung Foundation and buy early and buy lots.
Right,
please.
yes, that's right. Do two things at the same time.
Yes.
We should have jewellery, lots of knitting. I've got a stall of crafts from Asia that I collected on my travels.
Right.
We've got stationery, like cards, homemade cards, some sewing, some quilts, some vintage ceramics, and somebody's donated a very beautiful Spode coffee pot.
Have they?
Yes, it's really
So what are you
nice.
going to do? Are you going to do? Are you running a raffle?
Yes, we are.
Oh,
We've got
good.
some lovely prizes.
Excellent. Good.
Can I just tell you who's donated prizes?
Absolutely.
Okay, Fruit and Flowers have offered to donate something for us.
Mm-hmm.
The Blurb in Felixstowe.
They're proving very supportive of our community.
Yes,
actually.
no, they are.
They're acting as a booking office for the play in health and sickness.
Yep.
They're becoming quite a very supportive shop, which is we could do with more.
Absolutely.
Well, we could do with more shop.
Yes, I know, exactly. The Orwell Hotel is also donating a prize.
What, the bridal suite for a weekend? Oh, that would be good.
No, we can only offer prizes up to a certain level. That's part of the deal, I'm afraid.
No, that's fine. I mean, anything can everywhere. So that's the Orwell. Who else do we have?
Gosh, where did I get up to? We've got fish pedicure from a local company.
Put your feet in.
That's right.
And they nibble away.
Yes, it is quite nice.
Yes.
I've had that done. It's nice.
Is it?
Yes.
Did it work?
Well, it made me feel much more relaxed.
Oh, right.
It was quite lovely.
Do they do a whole body pedicure? That could be interesting.
Oh, that would be strange.
Yeah, we won't go there. You can cut that. I mean, not for transmission, is it? Really?
Right.
Because they'd nibble on bits, wouldn't they?
Yes, they would.
Yeah, that could be interesting.
Yes.
Onward
anyway,
we go.
Moving on. Yes.
Moving on swiftly.
So we've got lots of prizes, lots of stalls, lots of cake. Oh yeah, we've got a produce cake as well.
Oh, lovely, because cakes are always a winner, aren't they?
Absolutely.
You know, that is one store you can, regardless of where it is, when it is, what time of the year, cakes always go.
They do, don't they?
And there are some lovely cake makers, aren't there?
Yeah,
They really are. Very good.
We've got a lot of lovely cake makers on board as well, so that's nice.
So there you go. I mean, it won't only just be any old cake, it'll be homemade, proper stuff.
Yeah.
With the choice of cake, obviously.
Yes, lots of different choices of cake.
So there'll be a chocolate.
Yes, chocolate.
Which is my favourite.
Okay, right, I'll make a note of that. And also we've got jam as well, homemade jam.
Oh, right.
Yes.
What, and pickles or just jams?
We've got a few pickles.
Right.
I mean, hopefully, if we've got time, we'll have a few more.
Right. This sounds like work in progress.
Yes, no, it is. It's.
So what about if somebody seeing this would want to be taking a table or whatever? Is it too late to...
I think we've probably got space for maybe one more.
Oh, well, that's good.
Yeah,
it's nice to have
really
a full venue, isn't it?
Yeah.
So, and Trinity Methodist must be the biggest venue in town then this weekend.
I mean, so, yes.
You know, if we look at this, I went and had a quick look at this last night, and this is the Felixstowe Art Group. And if we have a quick look, you know, they always do that vote of best in show.
Right.
But if we look at this, and there are more paintings than this, there are 236 that are in the actual show itself.
Right.
236. I defy you not to go in there and find something that pulls your chain.
Yes, I'm certainly going to go and have a look.
Yeah, I mean, the one that I really liked was the Highland cow.
Right.
With one eye blinking at you, sort of Agnes, and it really is. It's a nice piece of work. But then I'm a sucker for those, and there were, needless to say, a number of Martello towers scattered through all of the displays, and we could do with more of those artists out there.
Yes.
But I mean, when you consider how much you pay to access the Felixstowe Art Group.
Yeah.
Which is nothing.
Right.
You know, for them to do that and then come and have a cup of coffee.
That would be lovely.
And a cake with you.
Yeah, and
thereafter.
Support the charity too.
So it would be great, wouldn't
it?
So are they able to access you through or just on the front door?
I don't think so. I think you have to come out and come into the actual church.
Okay, right. Well, that's grand on that. Perhaps what we could be talking a little bit about would be who exactly is the British Lung Foundation. It's hardly the trippiest of words, is it?
Not really. It's
but they've got a. I mean, it says what it is.
Exactly.
That's for sure.
Yes. Yes.
So what does it do?
Well, the British Lung Foundation. This was a charity that I personally had not heard about until after my mum had got sick.
Yes.
And they actually do some really, really good work. They support people. They put people together who have lung diseases. If you're confused or unhappy or want information, they've got a helpline. They also do training. So
the helpline, is there sort of a real number?
Yes, there is.
What, a real person you might talk to?
I believe, yes, of course, rather than press 1 for...
That drives me buggy, I'm afraid.
Proper people, and they actually, I believe they're staffed by nurses who are specialised in lung disease, yeah. Right. And if not, they will put you in touch with somebody who is specialised in lung disease. And their number is 03000 030555. So
that's sort of that's memorable. But what we will do, we'll put it up on the site with this.
Okay.
In fact, what we could do is
can you put a link to their website?
Yeah, we'll do that as well. I mean, bang out the website if you wish.
Okay.
As you know, I'm an analog man.
Okay.
So I don't really know what I'm doing on internet television. Actually, I should perhaps be off on analog television.
Right. Okay. The website is www.blf.org.uk. And they're very helpful. They'll be able to help you. They'll be able to put you at ease if you have any problems concerning your lung condition. And they have community nurses as well who go out and work with people with lung problems.
So did Pam receive actual help from these folks?
We didn't know that they existed.
No. And this, sadly, viewer, is true of lots of illnesses and diseases. There is actually a huge amount of knowledge out there, and most of the knowledge and the current knowledge and the knowledge that might help you is actually the people that have suffered it and the people and their family who've actually gone through them with it, isn't it? And that knowledge we don't seem to garner, do we?
This is another thing that they do is they've put together a questionnaire, and this is particularly about idiopathic pulmonary fibrosis.
That trips off the tongue.
Yes, that's
so much like dyslexia for people who can't spell.
Right, IPF for short.
Okay, right.
And that's the disease that my mum had. Yeah. And they ask people about treatment that they're receiving and how effective it is, and in that way they can actually hone the treatment to make it more effective. Because currently there is no cure for this disease, and treatment is very, very limited.
Right. So what you were saying to me off air was that instead of the lung being flexible, so you could have an exchange of oxygen and all the chemical bit.
Yeah.
It actually goes hard.
Yeah. That's
like a
what
board.
It does. Yep. As hard as a board.
So as that progressively hardens, then the ability to breathe reduces.
Yeah.
So other than a transplant, I suppose, that's the only. And sadly, we're awful in this country, aren't we, with regards to the number of us who post our own death exchange of organs. I saw the figures and they were quite unbelievable, you know. And there are a number of cases where the the person involved had volunteered that they would, and then the family stopped it
Oh,
post-death,
really?
which is quite strange.
Right.
Mind you, I didn't realise that even wills can be overturned.
Oh, can they?
Yeah. I mean, we all think there's, my last will and testament. Well, only if your executors go along with it,
Right.
and they can switch it. But don't be distracted by that. Let's look at the British Lung Foundation as
Right.
we go. I mean, the thing that I raised with you earlier is my brother-in-law sadly died from asbestosis,
Right.
and he contracted that when he was working in a shipwright in Plymouth dockyards. Now, fortunate is not the right word, but at least he was dealt with properly on the basis that there are tests that they started to have to do in the dockyards because of the spike of asbestos occurring in Portsmouth, occurring in Plymouth, Rothside and other RN dockyards. And he had a pre-existing condition, I think it was called plaque, something like that. And then because that doesn't always go on to full-blown asbestosis.
Right.
But sadly, in Terry's case, it did. And it wasn't, it was quite along at the end, though I feel he intervened on his own behalf, actually. Though he never said that pre the event.
But it's true. If you have a persistent cough, go to the doctor and get a diagnosis, because an early diagnosis is key, because like you say, if you do have something that may or may not develop into something else, the sooner you treat it, the better your chances are.
Absolutely.
And if you have something like IPF and you get an early diagnosis, you can go on the waiting list for a transplant.
Absolutely.
So you have more chance of getting a transplant. And please deal with these people, because they will help you. If you have a lung condition and you're finding it difficult or frightening to deal with, talk to these people, because they can help.
But what I noticed in there was that they actually run courses, do they not, for builders, and I suppose really the general DIY guy,
yes, that's right,
on how to treat asbestosis. I mean, there is another instance, a friend of ours, her husband was a builder who specialised in roofs, and only once in his working life did he deal with asbestos of the blue variety. And they had documentation to prove that.
Right.
Sadly, he contracted asbestosis. After his death, it was determined that that which had killed him was blue asbestos.
Right.
His widow then had a case because she could prove what contract it was that he worked on, where that happened. And builders, etc., are obliged to carry insurance on their, contractors, and they have an obligation to make sure that they work in a safe environment. She had to go all the way to the High Court, and they took her right to the wire. She was about to depart here to go to Manchester for the hearing. Of the morning of the hearing, they rang and settled.
Right.
And that's how, I mean, it tends to be the insurers who try to give the least and take the most, don't they? But the point was, he probably did all the things that he should have been doing at the time he was doing it, but things move on, don't they?
Yeah.
So in here, there was a bit, wasn't there?
It's called Take 5 and Stay Alive, because it's a very short course on how to deal with asbestos in buildings, and it's for building professionals and for DIYers.
Yeah.
So and again,
there are a lot of us.
Yes.
And we do, and perhaps we don't. And some asbestoses appear to be worse than others.
Yes.
Brown and blue seem to be particularly. I don't know whether they break and become fine particles. I don't know, but
I think these people, they will tell you.
Yeah,
basically.
I'm sure they would. Yeah.
But there's a link to it on the website.
So I think really a service FTV could do is perhaps get in touch with their local organiser. Now, do they actually have a support group here in Suffolk? Do we know?
I'm not sure. You were talking about something earlier that may have been organised by them. They do support groups, and the best way to find out is by getting in touch, calling them, or contact them through the website. And so if you're looking for a support group, they'll be able to put you in touch.
Right, so I think we need to extract that from this, and our ever-ready technical crew out there basking in the glow of first interview done successfully will no doubt put it up. Now, we've got 5 minutes to go, so what are your sort of hopes on what sort of attendance and receipts you may get out of this fundraising sort of venture, and would you be looking to do it on an annual basis? Because I understand, sadly, today would have been Pam's birthday, would it not?
Yes, today would have been my mum's 79th birthday.
Yeah, she deserved longer, didn't she?
She did. So we are putting this together to celebrate that.
Right.
And also to raise money and to hope that other people don't have to go through what she's gone through.
It's certainly the information. I recently attended a meeting that was called by the Clinical Commissioning Group, which is now taken over from the PCT. And one of the things that they were very keen to do was that the community becomes much more aware, becomes much more proactive in staying fit and well. And that's really a part of the program. Now, that wasn't presented at the Clinical Commissioning Group at all. And I suppose I've got quite a lot of experience with the Cancer Research Group, who do a serious amount of fundraising, and needless to say, they have a charity shop here in town. So more people get impacted, don't they? Yeah. So I suppose that's what it is. I mean, I find it a little disturbing that your mum being diagnosed with that condition, that the medical professionals weren't sort of signposting then to the help that is available, or even if it's a national bit, it's a link, isn't it? I mean,
it's really difficult.
It's kind of difficult. Who's responsible?
Well,
and
yeah.
Perhaps nobody.
Also, when she came back from the doctors, all she said was, "There's nothing they can do about it." And then that was it. She didn't say anything.
Oh dear.
Because again, I think that's the generation, isn't it?
Yeah. Well, yes. I mean, they were that. Sort of keep calm, carry on.
Yes.
And your mum was certainly of that.
Oh yes.
Of that idiom. Nothing phased her too much, did it? But that must be quite a devastating diagnosis to be told by your GP one sunny morning, sat down, hoping for something better.
Yeah.
But it's not true either, is it? Because nothing can be done. But in the not doing, you can get support from the British Lung Foundation on how at least to mitigate things. And also, I suppose, you can approach what the unknown will be.
Yeah.
Because you can talk to folk who are along the pathway.
Exactly.
And I mean, this is one of the big things that we used to put in as evidence to the court and to the PCT and anybody who would listen, that one of the great strengths of the Bartlett and Nightingale Awards is the fact that there will be patients in there who are further along the road to recovery, who actually help the new patients coming in. Yeah. Because you don't have enough staff to sit down in heart to heart, do you? I mean, even less now. I mean, we're told there are insufficient in lots of hospitals, staff to do the basic necessary. So I don't know, I'm not over enamored of this very high level of hoteling that seems to be what people who are ill seem now to want. You know, their own private room with 40-inch TV and the rest of it. It's sort of isolationist, isn't it? It's very, I don't know they get better any quicker. They certainly, I know when I've been in hospital, it's been those who've been on the ward that have actually jollied you along, and you've jollied them along, haven't you? And it is a sort of a collegiate view that comes out of a ward. So this strikes me for anybody with any of those sort of problems is not a prop, but at least they can tell you what you could be doing. Yeah,
no, community is very important in your recovery, definitely.
But I've never seen one of those in my doctor's surgery.
No.
Not knowingly.
No.
I mean, it may have been there. I mean, it's perhaps, we should really get a better title, but I don't know. I mean, it's what's on the label, isn't it? It's the British Lung Foundation.
But like you said, it does what it says.
Yeah.
So, you know, there's no confusion there, is there?
No, absolutely not. All right, Laura, that's lovely. And will they be playing Dr. Zhivago during the course?
I sincerely hope not.
Are you sick of that?
Oh, yes.
I mean, where did you get that name? Because Dr. Shiv had just been released. It would have been about that time. Oh, sorry.
My mum swore blind that it had nothing to do with it.
I thought it was wonderful.
Yes.
I thought it was, my wife hated it.
Really?
It was all too Dickensian type.
Okay.
I mean, that's why the Russians love Dickens. I think it's so descriptive and.
Yeah.
That's not cut to the quick. I think
we'll
get on with it. But no, I loved it. Anyway, thank you, Laura.
Thank you very much.
That's awfully kind, and I assume the man with the switch will be approaching it shortly. We hope to see you soon. yet again. We do need to get back onto the health trial. We did say in February, January that we'd be doing that, and seeing as now the clinical commissioning group are approaching it with some zeal, perhaps we can invite one of those in to tell you how you can help yourself and stay healthy. Goodbye to you. Goodbye from Gainsborough Studio.